COVID-19 affects multiple parts of the body, and that makes treating it pretty complex. Sarah Jones talked with a local doctor who reports in that fight of caring for patients, the PPE supplies are strong, but staffing to do the work is lacking.
The digestive system is not immune from the effects of COVID. We noticed that in about maybe 1 out of 3 to 1 out of 4 patients with COVID, they tend to have digestive symptoms, abdominal pain, diarrhea, nausea, and vomiting. And some have acute liver problems where their enzymes go up in the blood.
Dr. Al-Haddad said the symptoms tend to settle once the virus has worked its way out of the digestive system.
Patients with COVID can develop something called acute pancreatitis. And some of them who are known to have chronic pancreatitis from before tend to get more relapses after COVID for up to a year.
But it's still unclear how many of these symptoms will become chronic. COVID-19 has changed the way gastroenterologists do endoscopies.
When we had confirmed cases of COVID, we usually request the general anesthesia. Obviously, this is more complex than just simple twilight sedation. Also, the way you intubate and extubate and how long you wait.
And the Delta surge is bringing back a bit more protection.
Right now, we are going back to heavier personal protective equipment. Luckily, we're not too concerned like we were back in the spring of 2020.
But there's still that concern about healthcare's capacity and infrastructure.
Even if you get an illness that keeps you at home for 5 days, you're going to leave a hole behind in the hospitals.
Dr. Al-Haddad remembers during the second surge when the vast majority of ICU beds belonged to COVID-19 patients. He says that there are more ICU beds available right now. But could this be because most hospitals have increased their ICU capacity since the pandemic began?
We have expanded the bed capacity, but we were unable to, and this is a nationwide shortage, we are unable to get healthcare professionals to join our forces.
Dr. Al-Haddad says he doesn't think the third wave is going away anytime soon.
Maybe potentially up to 2 or 3 months.
He says the majority of critically ill patients are unvaccinated.
It's a disease that happens to a large extent by choice rather than lack of choice when it comes to things like vaccination. Obviously, we don't discriminate when a patient is sick, whether they're vaccinated or not. We take good care of them in the best way possible. But it's hard to maintain that level of empathy among team members, knowing that some patients have had the chance to really avoid getting in the ICU for a month and they passed it on, and now they, if you ask them, they'll tell you, I wish I took it.
The pandemic has also taken its toll on healthcare workers.
The stress and anxiety levels among my colleagues is at an all-time high. I can assure you, if you work in the ICU or the emergency department consistently, you are extremely prone to PTSD after this.
And although it's brought many dark days, which Dr. Al-Haddad says will require long-term mental health support, the vaccine has helped to bring some brighter days.
Nursing home patients who we knew they would come to us and they would die in our hospital were actually either not coming to us or they would come for a couple of days and leave and not even require oxygen. It was remarkable.
And he says the fact that scientists came together to serve humanity when everything was falling apart is humbling and inspiring to the next generation of healthcare workers and scientists.
Dr. Al-Haddad works at IU Health. He also is an associate professor at the IU School of Medicine. We've put together a lot of stories like this, talking directly to the people working on the front lines during the pandemic. If you'd like to hear some of those conversations, all you have to do is head over to our website. You'll find them all at WTHR.com/behindthemask.